Good morning, everyone. I'd like to call the meeting to order for today. First off, I'd like to acknowledge that the TNRD, we connect with many First Nations communities across our vast regional district. Today, we're located on the Tecumseh-Secwepemc territory, situated within the unceded ancestral lands of the Secwepemc Nation. The TNRD appreciates the partnership that we have with Tecumseh-Secwepemc and respect the territory and land on which we gather today. And there's a recommendation for approval of the minutes 3.1.
So moved.
Moved by Director Stamer, second by Councilor Sarai. All in favor? Thank you. And I'll also note we have a few directors joining us online today as well. So, all right, we'll move on to 4.1, review of 2022 minor capital funding requests under 100,000. And I'll invite Diane Kostachuk, Director of Business Operations for IH. Thank you.
Is this like? No, it's okay. Yeah, okay. That's the right one. Yeah, thank you. Okay, good morning. Thank you for having me. So I'm just going to quickly review the 22-23 under $100,000 funding request. There's a number of items on there. I don't think we want to get into specific details on all of them. So I've just kind of reviewed it by site, by location. So first off, we have Ashcroft with a budget of 32K request. And again, it's lab equipment replacements. And for barrier, that's also what we have on the list is lab equipment replacements. You know, you will see a theme through this that generally, certain specific items are prioritized. Also, they will have the same, a lot of these items will have been purchased in bulk in the past, so their useful life will also be about the same estimated useful. Chase, we have a tub replacement that's used for bathing for the home health program and a defibrillator. Clearwater, we have lab and imaging equipment replacements. Lillooet, we have imaging and a procedure light for the operating room. Nicola Valley, we have again lab equipment, including an iStat analyzer, and I just kind of highlighted that because that's a handheld point of care device, which is kind of different. Minor equipment for Kamloops. This is for the community area. So wound therapy, I think there's 3 of those machines on the list. And a bariatric bed. Overlander also has a bariatric tub and a pressure relief mattress. Ponderosa Lodge has a Deco washing disinfecting unit. And Royal Inland. So Royal Inland has obviously the bulk of the request on there. So the total request is about 1.5 million. The RHD share is 618K. I can't remember off the top of my head, sorry, I think 40 some odd items on there. So I just kind of highlighted a couple of the high cost items. I can't even say, to be honest with you, the first one, I can't pronounce it, but it's used in lung function testing. There's a couple of ventilators on there, ultrasound transducers, imaging, which C-arm, which is a actually X-ray device shaped like a C. Scopes and scope testing equipment and surgical. So, the equipment for Royal Inland again really focuses on lab and diagnostics, and the surgical program takes a significant has a significant number of requests in there. And that is it. So I don't know, is there any specific questions?
Thank you for that presentation. And we have one question coming up from Director Birch Jones online. Director Birch Jones.
Thank you so much. And I just wondered, looking through this listing, first of all, what light, procedure and digital detector. I didn't understand a lot of the terminology. I did ask, but I didn't get a solid answer. And when you talk about the equipment for Lillooet being for the operating room, I'm sure you're aware that our surgical program has been closed. And I just wondered, how old is the list that you're working from? I mean, optimistically, we'd like, so is this a relatively recent request from Lillooet District Hospital that you're fulfilling with the operating room equipment? And does that mean we can be optimistic about the operating room opening up again? Thank you.
Sorry.
Hi there. So for Lillooet, yes, this is a recent request. Where are you?
On Zoom.
Oh, online. Okay. Thank you, Vivian. So yes, this is a recent request. And the reason why is because in 1 month, we will have our 5th physician joining us. When Nancy Humber is back from her leave, our GP surgeon, we are looking at restarting that program. And so when we looked at the restart, this was something that was required for the area.
Thank you so much. Hello, Lisa.
Hi.
Thank you. Any further questions from the board? Director Grenier.
Thank you, Chair. Thank you for coming today. I'm new. There's a few new directors here. We're dealing with our first hospital board budget. The numbers are telling me you're asking for a 27% year-over-year increase. And I might have that wrong, but that's what I keep checking the numbers, and it's a 27% year-over-year increase. And I think, what would the taxpayers ask me to ask you about a 27% year-over-year increase? We know we talked yesterday about 8% cost of inflation or CPI this year. Twice that would be 16. 3 times CPI would be 24, but this is 27. So I guess, have I got the number right? And what has the historic increase been year over year, so that we have some way to assess 27% year over year?
So I'm not entirely sure where the 27%, are you comparing like the under 100 equipment
The
last year versus this year? Is that what you're?
Yes, 739,306 versus 940,256 is 27% year over year increase.
So it's actually, I think, the request for 22-23, which we just looked at, is the $900 odd thousand dollars.
Right.
The request for 23-24 that we're going to talk about later is actually the lesser amount of 677. So it's actually the other way around, and we're asking for less on the go forward than we have on this 22-23.
So if I have that wrong,
Yeah,
what
yeah.
is
So,
the percentage year over year increase?
so it's not, in the under $100,000 equipment, we don't ask based on a percentage or a fixed amount. We prioritize the equipment. And then we've always had kind of a floating amount with this regional district in terms of they've been open to, anywhere from $600,000 or $700,000 to up to $1 million. So it's based on priority as opposed to a fixed dollar value and an increase on year over year. So this particular ask, these were the number of items that were the highest ranking that we put forward for request. So in terms of like an actual, it's not really inflation. We're actually asking for more pieces of equipment in 2022-23 than we were in. Then we will be in 23-24. Does that make sense?
I understand the process, and
Yeah.
you've got a wish list and a selection, and you
Yeah.
tone that down. I understand that.
Yeah,
And you can't pronounce that. I couldn't tell you what that machine does.
I know.
I don't
what
think
it
the
is now.
taxpayers expecting us to know what the equipment is.
Yeah.
I do think the taxpayers are asking us to ask the question relative to inflation and other budget items that we're contending with. Is this a reasonable number to go back year over year? And I've got the number wrong. You saying 27% is not the right number, but you wouldn't be able to tell us what the right number is in terms of year over year changes, maybe the last 3 years or so?
No,
on
I
these
can't,
100,000?
no, I'd have to go back one more year to what the third year was, but I think again, it's based on volume, and not really inflation,
Right.
right? It's asking for more pieces of equipment. And because we don't have a fixed amount,
Yeah.
we've just been asking, based on, we have this many items that are high priority For this particular year.
Okay.
Thank you. Oh, sorry.
I'm just wondering, does anybody know what the year over year increase? I got it wrong at 27% because I compared those two numbers.
I don't think off the top of our heads, but certainly we can ask something like that from CFO Fox as well. And it looks like, and we'll have that emailed off to us. And to that point, it was, very informative that it's a different equipment request as well, year over year, not just inflation. So, and I have a few more questions on the floor, and I would like to go to Director Roden.
Thank you, Chair O'Reilly. No, this was to Director Grenier's question. It's not as if they're buying the same thing year over year, and so the costs are going up, and why did they all go up by 27%? Every year, the list is completely different, and it varies depending on what the various facilities will say. These are our top priority items. And one year, the top priority item for Ashcroft Hospital, to take an example, might cost $10,000. The next year, the top priority for Ashcroft might be $25,000. And so that's why you see the fluctuations. It's not that the budget has increased by 27%. It's that the aggregate of the requests for this period has totaled that, and it's 27% more than it was last time, but next time it could be 15% down, and it just depends on what the various facilities say. These are our priorities. This is what we need, and this is what we can afford. So that's what I would say if anyone questioned you and said, well, why is it so much more this year? Because they asked for more equipment that cost more, is the simple answer. If that's.
Thank you. We will move on to Director Stamer, and then it'll be Director Hall. Director Stamer.
Thank you, Mr. Chair. I got a two-part question, and thank you very much for coming, by the way. So this equipment, I know we're trying to catch up. So this is basically equipment from the previous year. How much of this equipment's already been purchased? Because I know that there's a significant increase in costs and all this stuff across the board. Are we confident that this equipment, these numbers are going to be true? Like,
Yes.
most of this stuff has been ordered or paid,
Yes.
it's right
Yeah.
here, right?
Yeah, no,
Okay.
most of it has been either ordered or already purchased.
Okay, and if I could, just as a point, as Director Roden has mentioned, is that there is more equipment on this list than we normally have traditionally. I mean, I've only been on the board for 4 years, and you're right, it would be between 6, 7, 900,000 when the MRI request came a year ago. That was going to significantly increase, that portion that we would have to pay. And I certainly have some questions when we get to the next part of the presentation, but I agree, there's a lot more equipment on this ask, and we're probably getting a pretty good buy because it was actually purchased a year ago. So thank you for that.
Thank you, Director Stamer. Director Hall has given up his spot, and we'll go to Director Onslow.
Hi, good morning.
Good morning.
I'm just curious, looking at this list, I see there's no mention of the Blue River Health Clinic, and I'm Area B up in Blue River. And I know that the nurse who comes in has asked for equipment for certain things. Would this be something that's outside of this budget, like the equipment that she's asking for? Or like, I just am curious about that process, because it's been many times that equipment's been asked for.
Yeah, I can't speak to the specific. But
Okay.
So the nurse is asking for equipment under 5,000. So we're under 5,000 list. We actually purchase out of our operational dollars. So the way that we do this work is we sit down with our local teams, our physicians and nurses, look at what's needed, look at what's under 5,000, put those on our cycle for operationally replacing them. Anything over 5,000 and under 100,000 goes on this list. And then we work at a larger scale where we involve usually our larger teams and physicians at the site to put in place the priorities. And then we look at what may be end of life and functioning poorly. Those wind up being prioritized first. New technology or anything that we want to add for new services goes next. And then we try to be as judicious as possible. We also reach out to our auxiliaries and other funding mechanisms, and we try to fund that way before we come here as well, because I live here and pay taxes too. So we're trying to keep this as streamlined as we can.
Okay, thank you for that.
Thank you. Any further questions? Director Houghton.
Doesn't really pertain to this list, but I was supposed to go in for a CAT scan next month. And I got a phone call just the other day saying the CAT scan machine's down. We're gonna ship you to Salmon Arm. Is the CAT scan machine fixable, or are we gonna get a new one, or what's the verdict on the CAT scan?
A little bit of both. So the CT scanner, so many of you probably heard, we did have on December 23rd, we had a flood and it was in the roof over our medical imaging area. What we found through working with our medical imaging partners is the one CT scanner actually needs to be replaced. And so I can tell you it's been ordered. It will take a little while to get here. And we also had a downtime in the last 24 hours with our CT scanner, but it was back up and running last night. So we have a scanner running and one is on the way, but it will take a little while for it to get here.
Thank you. All right. Oh, sorry. One more further question, Director Goetz.
The CT scanner, was that an insurable item or is that out of pocket item, or is it half and half, or what's the situation on that?
There is an insurance claim that they're working through at this time. And so the teams are working through that right now.
Thank you, Director Stamer.
Yeah, thank you, Mr. Chair. Just for clarification, how long is it's going to take time? Any idea? Definitively? I mean,
I'm always hesitant to give a firm timeline, but it has been ordered. I'm gonna say mid-March if everything goes super, that's best case scenario. If everything goes really smooth, that's what we're working towards.
Thank you. All right.
I'll move recommendation 1.
At this point, we're still on review. So now we'll move on to 4.2 and we will ask CFO Fox. Thank you.
Thank you. I just want to clarify, with the minor capital bylaw coming forward, that bylaw is focused on our previous format, and we're looking at the 2022-23 capital. The total in that request is 940,256. So I want to clarify that because the information this morning, the $677,000 request is a 23-24 request. So those are two separate. That one will be coming forward in March. So the bylaw we're bringing you right now is focused on that initial request, which is the 22-23 capital, and that's based on the practice that we've been following up until now. I want to clarify just the question that was coming up, just so people are aware that the tax requisition for the hospital district has only gone up 1.5% over the last 2 years. The process really with this budget is mainly around capital. So you're taking the total capital requirements that you need, understanding that the tax requisition amount is coming in at about $16 million and only increasing by 1.5%. So if that's all you're getting, you have to then decide based on the capital requests that are coming in, if borrowing is required. So you're still trying to maintain tax requisition that is consistent and it's not jumping around all over the place. And you're deciding whether the capital requests coming in need borrowing. The whole function of this budget is really to provide some tax dollars for their capital and borrowing for the capital. And we do have some money in reserves that's funding the bigger construction project, the patient care tower. So between the reserves, taxes and borrowing is how capital is being funded on the long term. I won't reread through the capital bylaw. I'll just leave it at what it is right now if there's questions in that regard, but I think we've kind of talked about the 22-23 capital now. So you have an understanding of what that is.
Thank you, CFO Fox. We'll go to Director Grenier.
Thank you for that. I just want to make sure I understand the numbers. We had a number of 739,306. We now have a number of 940,256, And then you're telling us that we're somewhere in the mid 600s for the third year. So we did have a 27% year over year increase from 21 to 2022, and that we have a decrease in 22-23. Have I got that right? I understand the smoothing part, but these are the actual dollar requests for the under 100,000.
CFO Fox.
Thank you, Chair, through to the board. So now I can't speak for what they looked for in the past, but I couldn't respond to the increase and decrease over capital as we don't really focus on that percent. So I can say that if the $700,000 amount you're referring to was from the previous year, and then we're looking at 940 this year, it has increased. The percentage, I couldn't tell you.
So it says right here, the board approved bylaw 156/2021 minor capital equipment in 2021 in the amount of 739,306. And this period is 940,256. That is a 27% increase. Now, what I'm hearing, which I don't see that number, 660,000 for 2023. Aren't we approving the 27% increase in this second, third, and fourth reading?
So if it's 27% calculated between the two, I would agree that then it looks, then if you're looking at bylaw numbers and comparing numbers of bylaws, that could be the case, that it's 27% different, but the capital costs fluctuate year over year drastically. So we don't focus on the increase of the capital. So that is, it's just not a language that we're talking in. We're mainly concerned from our perspective of making sure the tax requisition and the amounts there to pay for the capital. We don't really debate the capital. Most of the capital is already purchased for that, or it's been ordered already. So I apologize if I'm not hitting the information that you're looking for, but I think you're probably calculated the percentages correctly. It's just not something we take into consideration.
Thank you, CFO Fox. Director Bass. Moved by Bass. Second by Council Director Sarai. And now that it's on the floor, we have Director Stamer.
Thank you, Mr. Chair. Yeah, I wasn't trying to jump to the guns to pay the bills. I totally agree with what Director Grenier is mentioning, and the optics look a little bit skewed because it is a significant jump between what was previous year to this year. But again, and I was one of the ones that was adamant in trying to get ahead of this curve so that we can actually have a list of equipment before we even, like before you're actually paying for something that it was a year late. It's pretty much kind of how it worked. We didn't have the same opportunities, hopefully, as we go through in this meeting to talk about 23-24. And I don't like the optics of 27% increase either, but when you look at the list and look at the amount of equipment that has been required, and understanding that if we had to do that same list this year, it's probably significantly higher than what it would have been last year. And having said that, we'll have an opportunity later in the meeting to talk about the next budget and the inputs that are into that budget. So I'm glad that we're at least at this point, and I support this motion.
Thank you. No further comments. I'll call the vote. All in favor? Opposed, if any? Thank you.
Move to.
Second.
Any comments? All in favor? On recommendation 3. Okay. Who was second, sorry?
Ranta.
Ranta, thank you. All in favor? Okay, carried. Okay, we will move on to 4.3, and this is the temporary borrowing resolution that CFO Fox has already alluded to. I won't have her comment, but I will open the floor for questions or look at the recommendation. Director Stamer, comment or moving?
I'll move the recommendation so we can speak to it.
Thank you. Second by Counselor Bass. All right, Director Steamer.
Thank you, Mr. Mayor. Thank you, Mr. Chair. Ms. Fox, can you elaborate a little bit on more why we would be necessary for us to have this resolution before us when we haven't had to do this in the past?
CFO Fox.
Thank you, Chair, through to the board. This report's coming forward based on what was done last year. This was something that, in my understanding, was approved last year for the temporary borrowing. What I'd say is it's all over the map of what other regional districts do. It's a best practice in case temporary borrowing is required. Sometimes timing of money and requisitions mean that we're not getting the money. And if for some reason we have big capital expenditures and we're paying those expenditures out and we don't have cash on hand, this gives us the ability to pay our debt and interest that we're paying right now. It's a little bit of a stopgap. I haven't seen it used. I haven't heard that people are using it. But when all of a sudden you need to have that short-term financing, it takes a period of time to go through that process with the board. So rather than trying to emergency stopgap something and come up with payments and go through trying to get temporary financing at that point, this is a way of just putting that approval there ahead of time. And the short-term financing and financing flexibility you see on the budget is really there in essence to be used for that. And why you're not seeing, if you look at actuals versus budget, you're not seeing any actual spent versus those dollars there. And they just carry over as surplus and reduce the amount of taxation every year. So it kind of offsets itself.
Thank you. Supplemental.
Thank you, Mr. Chair. And what happens if we borrow this for any period of time? Is there an interest accrued? And if that interest is accrued, who pays for that?
Yeah, thank you, Chair, through to the board. So in the budget that you would see previously, there's a line called financing flexibility and temporary borrowing interest. So yes, the short-term borrowing would have interest, and there is a budgeted line item to capture the amount. Right now, I think if I look at the 2022 actual budget, there was an amount of 219,000 for financing flexibility and 100,000 for temporary borrowing interest. So there's line items on there to capture those amounts.
And if I may, as a supplement, if there is interest that has to be paid, and let's say the provincial government doesn't pay us in time, do they pay that interest or do we?
CFO Fox.
That's a good question, and I don't have the answer. I'm suspecting because it's a budgeted line item, but with my lack of time here and experience with this, I'd have to find that out. I'm going to say it's probably something that we can't recoup. We would have to pay. However, because I know for municipalities, even with taxation, we have to manage our reserves and our deposits appropriately. Or if we're short to pay our bills, we know the timing of when the money comes in. So it's our responsibility to manage that.
Thank you. And maybe we'll just look for a follow-up email on that for clarification. I'll go online to Director Demare and then Director Rain.
Thank you, Chair. I'm just wondering if this is for operations or is it for capital replacements?
CFO Fox.
Thank you. This is for capital, essentially, because really 95% of this budget is capital related, if not more. I think there's only a slight line item in the budget that's $75,000 every year. That's operational. The entire rest of the budget is capital.
Thank you.
Thank you. Director Rain.
Yeah, I think most municipalities do temporary borrowing bylaws. And in most cases, you never borrow the money because you don't need it. Somehow it works out that you have enough cash. This is just a precautionary step. There's a very good chance that we will not borrow this money. There will be no interest charged.
Thank you. And sorry, we had a first mover and seconder already on this one. Madam Corporate Officer, yes? Yeah, thank you. We'll call the vote then. All in favor? All opposed? Any? Thank you. Carried. So we will move into the next one being 4.4. And I'll ask Diane Kostachuk to come up from IH once again. And, you know, I'm glad we're having this conversation right now. And, you know, frankly, this board we came together for the first time on December 15th. And with any new board, they have a bit of a different direction and interest of what we're going to want to hear. And I believe IH heard at that meeting what we wanted to hear and you know have already made big steps towards this. And so I welcome and thank you for coming to present this. So the floor is yours. Thank you.
Thank you. So we're going to review the over $100,000 capital funding request for 23-24, which as the chair has pointed out, in previous years, we would have had this discussion in March, and the expectation would have been the bylaw would have been drawn up at that meeting. So this is preliminary in the sense that this is obviously the final request as far as the over 100 goes. But it's the opportunity to have further discussion and contemplation about it. So let's just get started. I did want to highlight again, and you know, as it's been brought up, that the project escalation that we've seen over the last number of years and forecasting is up to 12 to 14% for 23-24 and 10 to 12% for 24-25. So looking at all our major projects in terms of, you know, reviewing them, ensuring that they're being done the most effective and efficiently as they can be done, working with contractors, et cetera, to, you know, keep the costs where they need to be. So this is just a summary of what's included in your package. And so starting off with construction projects over $100,000. Clearwater has had, I believe this was requested a year ago. The original request came a year ago. There has been a project increase. This is around replacing aging equipment for energy, struggling with my words, with new technology to reduce costs and emissions. The second item on the list is an elevator upgrade to Lillooet. So the existing elevator is old and the parts are hard to get. So that's what the request is for a replacement for that unit. The next two items are around the Kamloops area, mental health and substance use. As I'm sure you're well aware, there has been a significant increase in the investments towards mental health substance use. And so we're looking at co-locating the various services within the Lansdowne site and bringing all those services together, you know, definitely creates a better synergy for clinicians and clients. So that is the request there for the capital improvements to that lease. It's not the lease cost, but the capital improvements for the lease. And then that forces the one floor is currently taken up with administrative type staff, forces them out of that building and have secured a lease at Sahali Mall. So this is the capital improvements required for that lease. We'll also relocate administrative staff from the trailer that's downtown, or sorry, in the by the hospital into the Columbia or into Sahali Mall. The next request on there is around the cancer services, development of the cancer services business plan. So this is to expand cancer services at Royal Inland and looking at based on projected need, data, etc. Looking at what the long-term vision for a suite of cancer services at Royal Inland. And this would be from diagnostic to treatment. And within that, there is consideration for additional parking. On the under $100,000 list, Chase has two items on the list. One is around access control, implementing a card reader for entrance to the building. So obviously increasing the safety for both staff and clients, patients. And a staff duress system, which is basically a button on staff's chests where they can use to communicate to each other and summon help if needed. This is around a biomass burner. Don't know really what that is, I'm not gonna lie. But there is, the access right now is a ladder system and they want to replace it with a steel stair. There is digital health requests across the board. So the way that we do that is all of our digital health, unless it's specific for an area, when we do upgrades across the whole region. So we take the value of those and allocate them based on a population-based allocation. And then obviously from there, calculate the RHD contribution. So Thompson's 19% of the overall population for interior health. And so the overall improvements for digital health are in the range of 13.7 million. So that collates to about $1.04 million ask from this regional hospital district. So primarily those digital health improvements are around upgrading the tools that we use to do assessments for long-term care and for home health. And then including expansion of My Health Portal, which allows patients to see their records, but also allows people to make appointments. And we do have an area where we are trialing, trialing online appointments for medical imaging. So lab has been up and running for a number of years, but medical imaging is new. It's a little bit more complicated, obviously, than a lab test in terms of assessing the time needed to do the test. So that's kind of been one of the reasons it's been a little bit harder to get up and running, but it is up now. And I'm sure if people are interested, Lisa can speak to the success of that. And then with primary care, as we continue to build our primary care infrastructure, building the medical records and the tools that give clinicians the ability to improve or support their clinical decisions. Equipment over $100,000 is the next section. So 2 radiographic systems. So this is kind of your full suite, X-ray suite. And one for the North Hills area replacement, and then Lillooet Hospital. Both of them are replacement units. And then a nurse call system for Lillooet Hospital and Mountain View. So kind of similar to what I mentioned before, a button so that they can speak to each other and also get help if necessary. And I did in the package, and since we've been talking about it, there is the under $100,000 request for next year, but I didn't spend any time on that. Again, because the purpose of today's discussion and presentation is to allow for that enhanced consultation over the next couple of months prior to doing the bylaw. So that list, and you'll see on the top, it's identified as proposed. So again, there is opportunity for further discussion at the local levels with your local contacts around that list. That said, if there's any questions, I'm happy to answer.
Thank you. From my side, this is greatly appreciated. And I think the board appreciates having this heads up so we know what's coming down the pike. So we do have some questions. We have Bass, Stamer, O'Reilly, Middleton. In that order, we'll start with Director Bass.
Thank you. Comment and then a question which may lead to a supplementary. I'm glad to see that you're doing the work at Lansdowne Street. I've been through it twice now. It's an incredible thing and it's much needed. And I thank you for doing that. Moving on to Cancer Services Business Plan. Is oncological radiation going to be part of that? And is there a timeline on when we might see something happen?
Well, in terms of a timeline, we need to develop the business plan first. So, you know, and, you know, it needs to go through all that, the process, due diligence to the government. So I don't really think I could speak to the timeline, although I can check back and see if there has been any kind of higher level discussions. But the plan is built around, or to be built around, a full suite of services. So yes, that would include radiology if that's what works. So it's from diagnostic to treatment, full treatment.
Supplemental.
So assuming that we're going there, my understanding is that you would not be able to put it on the existing RIH campus, but move it somewhere else because of the necessity of the roof and all that other stuff. Is that accurate?
At this point, I can't speak to that because, again, the business plan needs to look at a couple of different options, right?
Thank you, Director Bass. We'll go to Director Stamer.
Thank you, Mr. Chair. Thank you for the presentation, Diane. Just a couple of quick ones. Is it possible to see previous year's requests in this summary when we look at, you know, some of the administration costs, the increase in expansion of the Lansdowne Clinic? Where do we get to see a breakdown, whether it's region or communities, on some of those? Like where does a person find that information? So in other words, if a certain region has 3 clinics and all of a sudden you put another clinic in there, how does that show up in the spreadsheet? How do we get to see how those parts get moved around?
So maybe you need to help me understand exactly the question. So first of all, a retrospective look.
Well, yeah, because just fill me in a little bit on this Lansdowne Clinic. I'm not familiar. Is it a fairly new clinic?
I believe we've been there for, I want to say 7 or 8 years,
Okay.
and over time, mental health has been expanding. but
Okay.
This is the person who knows.
Okay.
Hi again. So we've had 3 floors at the Lansdowne Center. And in those 3 floors, we've had our mental health clinicians that worked out of that area. It's an area where we're close to the population that we serve. We now have the opportunity to use the 4th floor as well as the building next to it. I'm sure that from previous years, you remember the bus, the substance use bus, RV, that was not workable moving forward. There were so many issues. So a physician moved out, and it's allowing us to do all of our substance use services in one building, but it has increased the floor print quite significantly. And a good majority of the area being renovated is for clinical service provision and physician service provision. And so we have to meet CSA standards, which it wasn't at. So these are the renovation costs. We've also had about a 22% increase in the number of personnel that are working in MHSU with our expanded services that have been rolled out, and we haven't a home to put them. So this is why the domino effect for Lansdowne, and then moving the administrative component over to the Sahali Mall, and then the Columbia precinct. I mean, I will miss my trailer, but we'll be moving out as well over to the Sahali Mall, leaving that space open as well.
And if I may, on the second question I had was on the equipment list under $100,000. I believe, Diane, you mentioned that we have the opportunity to speak to that in the next period of time, and you alluded earlier in your presentation about the auxiliary program and the opportunities with some of that equipment. When we talked in December, I was hoping that there was an opportunity where we could actually see the entire list and again work towards a 3 to 5 year plan, knowing that IH doesn't really do that. But being able to see that entire list, and the reason I'm suggesting that is because next year's proposal, for example, in Barrier, is 3 pieces of equipment when the want is actually 5, right? Mm-hmm. And so the only reason I know the want is 5 is because somebody that I know got a phone call to ask to donate towards the other 2 items.
Right.
I'd like the opportunity because we don't have an auxiliary and barrier to be able to see that list. So that we can actually have that discussion. And again, if Interior Health has, they're paying 60% of it, we're paying 40%. If Interior Health wants to make the decision on how we're going to arrive at that $677,000 budget, if that's what we're going to have going forward next year, I'd still like to be able to see the entire list, not have somebody make phone calls and say, you've donated in the past, can you donate in the future? I'd like to have the whole community involved and not just cherry pick through our community. Thank you.
Right. So there's 1,077 lines on the list. So I think I hear what you're saying. I think that the best way to facilitate that, and the other caveat I have to put in there is, the list does change again to what Lisa said earlier around prioritization. Things break, they're reaching end of life, new things come up, et cetera, et cetera. So there's always lots of variables in there. I don't have a problem. I could work with Lisa, or I believe it's Heidi, the manager at that in Barrier, to, give the list that's Barrier. I don't think bringing 1,077 line list here this particular venue would make anybody too happy. So yeah, we can definitely work towards that and share that with you for sure.
Thank you, Director Stamer. I'm next on the speakers list. Just two questions. One revolving around the $600,000 ask for the cancer center, a potential cancer center. I know you couldn't speak about timing, but in the same breath, with this ask coming forward today of $600,000, this isn't really something we'd want to spend and have sitting on the shelf for 10 years or however long that is. So if we have a little bit of an idea of some form of a window, at least, I think would make people feel a little bit more comfortable approving a $600,000 ask. And then my second question is revolving around digital health, what you had on there. Is there a component, will there be an online access to view wait times at Royal Inland Hospital like there is around other hospitals in other health districts, authorities? Thank you.
So I would have to take that back, to be honest, and ask about that. I know what you're talking about. I know in the Lower Mainland, you actually hear the different wait times on the radio. So that's something I would have to take back. And I would have to ask our CFO about what type of conversations have had at the ministry around timelines. But, I did understand that putting this on the list meant that this was a move forward, and, it wasn't a wish list. It was a plan to be developed. So, but I can definitely respond back on both those.
That's great. And I think it's nice that we have this, so we can have the discussion now, so that there is lots of time to get those answers. Thank you. Next on the speakers list is Director Middleton, and then Director Hamer Jackson. Director Middleton.
Thanks. And this isn't, this is just a bit of a terminology that I'm having a little bit of I'm just sort of wrapping my head around a bit. We're calling these, sort of capital project funding request list, but then we go down to call them construction projects in the body of the thing. And some of the stuff, like I sort of have a construction background, so some of the stuff that I'm seeing on what we're calling construction projects don't actually really appear to be construction in how I, real property, building something, hammers and nails. And so when we see a thing like, say, like the staff dress system, not that I don't think it's not needed, but is that properly categorized as a construction project? Because wouldn't that be a receiving station that's kind of plugged into a wall somewhere with a bunch of electronic badges that people are going to wear? And in my mind, that doesn't constitute construction. So I don't know whether the report should be labeled capital projects under 100,000 as opposed to being construction projects, or is this in the right category?
Good question. I guess it could be either, in the sense, I think when we're working through this and creating, the designation, it's going to have, because both those items in Chase have a facility component to them, like they're not straight up piece of equipment. They've been categorized as under construction, but yeah, they could, you're right. You know,
Yeah, I
it's
just
a
sort of
bit,
deal in real property versus non-real property and, you know, tangible versus non-tangible and kind of what Steve's about goes, it's just a question just to
Yeah,
ask is
no,
why, you know, when I see that, I would have thought that that would have gone in more into
equipment versus,
equipment versus construction.
yeah, no, good.
So, and I mean, you don't need to fix anything for me. I'm just making that comment because as I look through the list, some of that doesn't appear to be construction.
Okay.
All right. Thank you, Director Middleton. We'll go to Director Hamer Jackson.
Yeah, I'd just like to go back to the safe injection site that you had in the motorhome. And when you closed that program, there was a lot of media attention that went around when you opened the safe injection site on the Lansdowne property. So it was kind of quite a negative, perception in the media. So I actually had contacted Ray Sampson in 2020. And I'd asked her if I could go through the facility, and I did go through it with another counselor. And I encourage everybody to go have a look at it, because it's not just about a safe injection site. When they moved it, there's a lot of moving parts in it. It was very eye-opening. So I would encourage everybody, if they'll let you in the building, that's all.
We
Thanks for
would
that
be
comment.
happy, and we have tours available. If people would like to come in, I would ask that we do it after the renovation. But it's not just safe injection. It's actually coordination of care. So when people come in, they're not just taking their injection and leaving. We're coordinating access to life skills services. We're putting them in contact with recovery specialists, and we're working to meet people where they are to support them, perhaps moving to a different phase of their life. What I can say is that safe injection, when we had the mobile, we had so few. And over the last 6 months, we've seen a 500% increase in utilization of that service since we've had it available. And we're in a kind of a small area while we're doing the renovation. As you can imagine, it becomes a domino of building things. And we still are sitting at one of the highest areas in interior health for overdose deaths. So this is just a start to the work that we need to do here.
Thank you. And thank you for those comments, Director Hamer Jackson. To that point, it may be very good and healthy for this board to get an invite once those are done, and we'll tie it in with a future hospital district meeting so we can actually see where these dollars that we're voting on, what it's actually doing in our community and for the district as a whole. It would be a very good thing. So we'll have staff work through that, and we will now move to Director Getz.
Thank you, Chair. Just a question. In my past life as an IBM specialist, we're looking after provincial contracts and ministries, trickle down effect and buying new equipment. One of the tasks that I had when I was installing new equipment was disposing of the old equipment, and there usually was a cost to recycle this. Is this built into the new equipment costs, or is this something that you put in a closet until the closet starts to burst and then you do something with it? Or is that built into the recycling of the new equipment? I'm just curious.
Yeah, we build it. It's not built into this cost, but yes, we do. So we heavily discourage putting it in a closet and just because it tends to get used. Right. And then you're into a cycle of, your because all this equipment obviously is managed and maintained by medical engineers. So, if we say a piece of equipment is done, then we dispose of it to the best way we can. But that's not part of these costs. We bear the brunt of that.
Thank you. Seeing no further questions on the large ask, I don't think we need to go through the entire equipment list for under 100,000 that you provided for upcoming. But is there anything that any directors flag that they would like to ask a question on, knowing that's coming down the pike further on? If not, I'll ask for a motion to receive for information.
So moved.
Director Stanley, second by Councilor Sarai. All in favor? Contrary minded. Thank you. And for new business, Director Steen.
Thank you, Mr. Chair. Would it be possible at our next meeting to be able to look at some of our long-term capital projects? I mean, there's You've got new directors here. Is there a possibility that we could see a bit of a presentation as we move forward? I mean, we're talking about, cancer clinic improvements. We know we've been talking about the parkade. Is it possible to be able to put something together, Mr. Chair, and with IH on giving us a little bit of a vision?
Sort of a
What's-
longer term vision. So
Yeah.
I can't speak to a yes or no on that. I would have to take that back to our CFO and say, what would that actually look like? Yeah, and I will do that.
Awesome.
Thank you, Director Stamer. We'll definitely take that under advisement as we're planning future agendas, but I think that's a very good comment. Any new, Director Grenier?
Thank you, Chair. I would also ask for that because the questions that I was asking at the beginning of the session turned out to be mathematically correct. But the information that was there, you presented a slide a few minutes later that says increases are going to be 14 to 16%, then 12 to 14, and then 10 to 12. So what I gather is we have a difference in the cash flow, which is the 27%, but the ask is still in these double-digit numbers, and it might be appropriate.
Mhm.
But it would be very useful for me, at least, to understand what your projection is relative to inflation and relative to what the taxpayers are being asked to pay year over year. And that would really be helpful if we can distinguish between cash flow and the long-term plans that relate to the draw of the cash. So thank you for that, Director Stamer.
Thank you. Thank you, Director Grenier. Seeing no further questions, similar to how I opened this, but I would like to thank IH for listening to the comments of the board over the past month or month and a half, and really allowing this board to be comfortable to make these decisions and hearing what they're needing to be able to make votes and be as educated as possible on that. So thank you very much. I will adjourn the meeting. We're good. Thank you.
It's funny because we had our own plan out, and it was like GT with the grandkids. And ready to go. Thanks. And sure enough, the wall.
Yeah.
They're
gonna have a break and then.
After Christmas, we're gonna take the grandkids out just out of town, and I got my old 9.5 sled running, and I found a whole bunch of firewood that was out in the bush one day when I was doing snow inspection, so I was all proud of myself. Then the gall darn weather warmed right up, and we couldn't do it, so I just took a whole bunch of the wood and had this huge bonfire. That's what we did in the backyard. So
That's awesome.
so it was
Not
fun.
for the kids.
Absolutely.
Love that.
Oh, yeah, we had went around the yard with the snowmobile, and we had the trampoline and all that.
That's where it was right up
Didn't
after
it?
Christmas.
And I think it was ironic because the other day I had to go to the Blue River, your neck of the woods, to look at a small business sale right along the pipeline. And I knew something was